Hi everyone, I am Dr. Ramprasad, your orthopedic surgeon specialist. Can hip pain caused by avascular necrosis of femoral head, means AVN, be completely cured by medical treatment? This is actually a burning question in the recent times because of late, every orthopedic surgeon, take for example me, we have been seeing not a marginal increase, a significant increase in the number of AVN cases presenting with hip pain coming to us in our daily OPDs. In simple statement, if I look at my private practice in the last 12 years, I used to see only 4 to 5 cases of hip AVN every month. But nowadays, in the last 1 or 2 years, I have been consistently observing 4 to 5 cases every day. So that translates to approximately 25 times increase of this hip AVN cases, mostly after COVID. Everybody knows that this is a long-term side effect of COVID or the steroid medication which have been the life-saving drug during the COVID times. Everyone feels that hip AVN, avascular necrosis of femoral head, is mostly a surgical problem. How can it be cured by medical treatment? This is actually a burning question among the patients. But in this YouTube video, I will be showing the medical treatment options available to these patients, and these medical treatment options are corroborated by the evidence from scientific literature, and most of the scientific literature evidence is contributed by a very big surgeon in Bombay, Dr. Sanjay Agarwala. And these are not only short-term results, means it's not 2 to 3 year results. They are long-term follow-ups, means 10 years, 20 years patients who have survived this medical treatment. So let's go straight into the medical treatment options available. So here I will be listing 5 medicines which are proven really successful in the treatment of AVN hip cases. The first drug which comes and tops the list is bisphosphonates. I call them as a wonder drug. It comes in oral formulation, alendronate 70 mg, or in IV formulation, IV zoledronic acid, and this alendronate oral form, it should be taken once a week, and this IV formulation of zoledronic acid, it is given once a year. It has been proven that if these bisphosphonates are taken continuously for 2 to 3 years, the results will show up if given in early stages of hip AVN, means stage 2 and stage 3. That is why it's called a magic drug for this hip pain caused by AVN. How this drug works means the basic mechanism of action is, if you take the pathology of hip AVN, the reduced blood supply to the femoral head causes that bone death. If any cell dies in our body, may it be bone or soft tissue, muscle or tendon, the macrophages, here the specialized macrophages for the bone are called osteoclasts. They come to the site of bone death and engulf those dead cells. So what happens is, if you just remove the dead bone from the femoral head, the cartilage on the top of it is devoid of the support from the subchondral bone. So that collapses. That actually changes the shape of the femoral head. That leads to incongruity of the hip joint and secondary osteoarthritis and pain and debilitating condition to the patients. So what these bisphosphonates do is, it doesn't stop the bone death. That is not the mechanism they work. They work by inhibiting or reducing the action of these osteoclasts. So they make the dead bone stay there, and this dead bone, first thing, it acts as a scaffold and provides strength to the cartilage. Yes, it's not a healthy bone, but still it supports that dead bone itself. The body has a natural healing mechanism. It will redeem the blood supply after 1 year, 2 years, may it be in the long run. It takes time. So if the dead bone is there supporting that cartilage and providing that scaffold, the body's natural healing mechanism of increased revascularization comes up, and the osteogenic potential will come up, and then again the femoral head will regain its shape, and it reduces that pain. So until that body's natural mechanism of healing and revascularization occurs, the dead bone should be there in the femoral head, and this whole purpose will be served by the drug of bisphosphonates mechanism of action. And the second drug which comes into the list is a blood thinner. Everyone knows it's Ecosprin. It is usually given in the dosage of 75 mg and 150 mg, and it's a simple logic that if you have a thin blood vessel, the thinner the blood is, more amount of blood can flow into the blood vessels. So it basically works by thinning of the blood and increases the blood supply to the femoral head. And the third drug which comes into the list is statins. And the typical statin we routinely use is atorvastatin 10 mg, and it's usually used in combination with Ecosprin. So it's Ecosprin AV. So these statins basically work by decreasing the fat deposition in the blood vessels of these small blood vessels of femoral head. So this Ecosprin and atorvastatin, they basically have a symbiotic relation or synergistic action, and slowly they increase that blood supply. But to be frank, the bisphosphonates are the main drug, and this Ecosprin and atorvastatin, and these are all the adjuvant drugs we used in the medical treatment. And the fourth drug which comes is silastazole. This silastazole works by dilating the blood vessels. Basically, it increases the caliber or the diameter of the blood vessels, directly increasing the blood supply. Hearing this mechanism of action, everyone can feel that yes, increasing the caliber of the blood vessels can make wonders. But this is not the case, because the femoral head and neck blood vessels are so thin, and the amount of drug reaching the real point of mechanism of action is very grim. And this dilation of blood vessels, it comes with a lot of side effects. Mainly it comes with a side effect of headache. So the patient tolerance is very poor. So in only very resistant cases we try this medication, otherwise we don't routinely use this silastazole medication. And the last drug which comes into the list is NSAIDs, means the full form is non-steroidal anti-inflammatory drugs. Usually these are the painkillers. They have this adjuvant action of antiplatelet, means it prevents the clot formation. So basically, if you can reduce the clot formation in these thin blood vessels of femoral head, it indirectly increases the blood supply, and they work by reducing the pain of AVN hip directly, and they reduce the secondary inflammation caused by bone death. But the only downside of this NSAIDs is you can not use it in long run, and at max I suggest my patients to use it for 1 month and then stop it and take a break. And if your pain really goes up, then you use it for another 1 week or 15 days, then again stop it. These are not the real long run medications that can be used, because they come with a lot of side effects, such as renal side effects and stomach ulcers and kidney problems and everything. I don't really suggest in long run. And to be frank, what I advise all the viewers and the patients of hip pain is these 5 group of medications, yes, they do work, but they are recommended to be taken only with the prescription of a doctor, and you need to be very careful about their dosages and the usage in long run and everything, and which should be only guided by a physician or an orthopedic surgeon. Finally, the basic intention of this video is to provide awareness for this hip pain and AVN patients, and to boost the confidence of these patients, and not to scare them that it's not only a surgical problem. You have some medical treatment options available in the present day medical field in science and technology. You don't need to really go for surgery in every case, and results are also not really fantastic after surgery. So please do consider the medical treatment options available. So thank you for watching our video. We'll meet in the next video on another medical topic. Until then, signing off, Dr. Ramprasad.